Team of doctors and pharmacists in Malaysia have started to provide free medical consultation at Mount John CG office since 4 years ago. While at the beginning there were not a lot of patients utilizing the service, the medical professionals gradually built up trust with the patients.
On Tuesday evenings, doctors of different specialties and volunteers are here to provide free medical consultation. 4 years ago, Tima doctors and pharmacists started to provide free medical consultation at Mount John CG office.
Patients face financial difficulties. A patient might not see the effect of his treatment at a hospital. Then he is forced to transfer to a private clinic. As a result, he faces high medical expenses. He would not dare to go there twice. This free clinic is a bridge that connects private practices and public hospitals.
On this evening, doctors from internal medicine and gynecology departments are available. Rajeswari, who rushed back to take care of her younger sister, is the first patient this evening. Rajeswari has a tumor inside her uterus and needs to undergo a surgery. Despite that, she's worried about her younger sister who needs her attention. Her younger sister is mentally challenged. Her parents passed away and her husband has abandoned her, so Rajeswari has to raise her child single-handedly. As a result, she almost lost her will to live.
If I go out, my sister cannot sleep. She screams and refuses to eat or take a shower. She does not do anything until I go home. So I cannot go anywhere. I cannot leave her.
Gynecologist Tan Ling Sen knows about Rajeswari's worries, so he proposes another solution.
So you do not need to undergo a surgery if you choose not to have it. But we need to adjust your medications. With this adjustment, if you do not bleed too much, I'd feel at ease. Do you have other questions?
When they first provided free medical consultation, there were not many patients who sought help.
Basically, we do not provide treatment. Some people asked, why don't you prescribe medications? We mainly answer the patient's questions. If needed, we'd advise the patients on where to go to receive treatment. This is something we cannot do at hospitals because there are too many patients. In one morning, you might need to see up to 100 patients. You are running against time.
The doctors and volunteers uphold their faith and gradually build up the trust between doctors and patients. They've also attracted more patients to seek medical consultation.
This patient could not find a suitable doctor, or his doctor cannot give him a good explanation, so his question remains unanswered. Then he came to see a doctor free of charge. The doctor mindfully explains everything. Although his problem is not completely solved, he feels at ease because he knows what kind of problem he is facing.
They help more patients and bring smiles to their faces. It's the sincere wish of these Tima doctors.
The spirit of